Good morning. I'm Samarakoon from Department of Physiotherapy, Faculty of Allied Health Sciences, University of Dehradun, Sri Lanka. I'm here to present my case study on the management of arm pain with swelling. The patient was presented with diffused arm pain in mediolateral aspect of the left side arm and arm swelling in left side compared to the right side and numbness in the fingers. The similar symptoms can also be observed in the conditions such as cervical radiculopathy, thoracic outlet syndrome, other neurological conditions in cervical spinal cord, lateral epicondylitis in elbow, and carpal tunnel syndrome in the wrist. The special orthopedic tests were used to differentiate the condition. Scalini cramp test was positive while the other tests were negative such as Sperling test, Wright test, Coulson test and Tinner sign. In Scalini cramp test, patient is asked to rotate the neck towards the affected side and pull the chin towards the hollow between the clavicle, above the clavicle, uh, while flexing the cervical spine. The pain was increased and the test was positive. Sperling test was used to differentiate cervical radiculopathy, Wright test for thoracic outlet syndrome, Coulson test for lateral epicondylitis, and Tinner sign for thoracic outlet syndrome. As the Scalini cramp test was positive, the condition was diagnosed as Scalini myofascial pain syndrome and the management was started accordingly. The Scalini myofascial pain syndrome is a condition caused by formation of trigger points in any part of the Scalini muscle. Initial measurements were taken on pain and tenderness by using visual analog scale, range of motion using goniometer, muscle strength using manual muscle testing, upper limb girth using measuring tape. I've taken the mentioned measurements and recorded them for each 5 appointments. Manual myofascial release and stretching of the scalene muscle was done. As myofascial release of the scalene was completed, the pain and numbness was reduced, and I moved to dry needling, stretching, and progressive resistance training. After the treatment regime, the rest pain was reduced by 7 points in 7 to 0 in visual analog scale, and left arm swelling was completely resolved. Range of motion of the neck was improved as mentioned in the graph. Finally, the releasing of the trigger points of the scalene muscle and other treatments gave excellent outcome of this patient. Thank you.